So with this, I'm, glad to, introduce Dr. Asela Kalugampitiya. He is a lawyer, holds masters in evaluation and a PhD in evaluation from Germany. He is the director for Center for Evaluation, University of Sri Jayabardhanepura, and he is a visiting lecturer of the Masters of Evaluation, University of Saarland, that is in Germany, and a visiting lecturer for monitoring and evaluation courses at the University of Sri Jayabardhanepura in Sri Lanka. Dr. Asela is the immediate past president of Asia Pacific Evaluation Association and has been working in the monitoring and evaluation field over more than 2 decades, including for, United Nations as a monitoring and evaluation specialist. His main expertise area is national evaluation capacity and development. Welcome, Dr. Asela, and if you can, come to the dais. Thank you so much. So can I request Dr. Asela to, if you have some reflections or inputs on that, please feel free to take your mic. Thank you so much.
Thank you very much. And also a great presentation from Dr. Soma setting the tone for this session. Now, I just want to mention a few examples how we can use gender responsive evaluation, equity focus and gender responsive evaluation for SRH programs. Now, in this conference, there has been a lot of discussion about abortions, use of condoms or SRH services. Now, let's take use of condoms, right? It's easy for us to say, okay, we promote condoms and how it is useful, and also the access to condom is ensured, right? But now, how do we know actually people use condoms and what are the barriers, right? And also, I know that especially among sex workers or even other women, condoms are promoted, and they take condoms. But whether they are able to ask the man to use a condom, what are the barriers women have to ask the man to use a condom, right? Now there may be several reasons for that, factors for that, and now this is where we can also see how equity focus and gender responsive evaluation comes in. If we do an evaluation and see the social groups or the education level or the income levels of men and women, and Dr. Soma mentioned about disaggregated data. This is where we need disaggregated data, not only between women and men, but also social class, different religions or other factors, and see what are the groups, especially women, are able to ask a man to use a condom, right, when they have sex, or what are the income levels that women are able to ask the man to use a condom. Now, these are some examples. And when it comes to youth, we usually say that youth have, access to SRH services, right? That is one of the results we expect. But at the same time, we know that some youth have the advantage to have access to SRH services, but some youth don't, right? But have we, taken or considered disaggregated data and see, okay, which youth groups have access to SRH services and which groups do not have access to SRH services, and what are the characteristics of this youth group. That is very important. This is where we can, through the evaluations, if we find out this information, this is where we can have our effective strategies to improve the services, right? And we know that now some of the indicators we use for monitoring and evaluation, let's take again condom use. Number of condoms distributed, how effective that indicator is, right? If we have distributed 100,000 condoms and only 10,000 use, 90,000 not use, right? Because that's where the quality, again, Dr. Soma mentioned about qualitative data and qualitative data collection. That's where the qualitative data is more important, right? The use is more important, right? So monitoring and evaluation, especially evaluations with disaggregated data, not only the gender, but other factors are very important. So you can have effective strategies, plan for effective strategies, and implement effective programs, especially for the program managers, whether they listen or not. Program managers, this is very important. Let me also mention very quickly about one example I have when I was working for a program in Sri Lanka, especially tsunami affected areas. This is during just after tsunami, we had a support for women centers, especially Matara, Hambantota, and Ampara, other districts, tsunami affected districts. Through these centers also there was an awareness program for men, and as usual the staff work during the day, so they planned these programs during the day. When you invite 100 men, what do you think, how many men attend this program? Yeah, less than 10. So I was the monitoring and evaluation officer from, of course, I was working for UNFPA at that time here. So we discussed this, right? And then we discussed, okay, what are the factors or, conditions for men to gather? In Matara, we discussed, okay, anyway, they gathered, after work around 6:37 for different reasons, of course. And then we discussed, okay, why don't we plan these programs? This is about male participation in prevention of gender-based violence, right? So they